My name is Wayne Samuelson. I'm a physician from the University of Utah School of Medicine. I'm here with some really important people. Dr. Laura Shane McWhorter from the College of Pharmacy, who's the real brains behind this outfit, and leads us and guides us with some of her students. We have medical students, and we're here working in Midvale, trying to provide some good care for patients who we hold very dear and we think are very important. And I think we have quite a number of folks that get their primary care from us. That makes us happy that we can contribute. So at any given time we will have students in medicine, pharmacy, we have nutrition students that work with us here, physical therapy students are very active here. The College of Nursing also has a program here that's run by their Doctor of Nursing Practice students, and we also work hand in hand with dentists, both community dentists, and I think the School of Dentistry at the university is becoming more involved. So this is an opportunity for us to do things that are good for the community, but also we benefit by the chance of learning to work together.
I have the distinct honor and privilege of working with all of these wonderful students and our patients, and I think that one of the big tenets of what we do here is to learn from one another, but also to learn from our patients.
I've been coming here for about, I don't know, about seven months. A couple times a month I try to come. And so again, just kind of have my first year of medical school behind me. And the Midvale Clinic has been a super fun, amazing experience. Just from an educational perspective, learning with other students, learning with doctors, learning a lot of actual hands-on medicine, which in the classroom we don't get a lot. But having these hands-on experiences is really exciting.
I really have enjoyed being here. The quality of care each patient has been given, and it's nice because you're learning from the patients, and I think that's very valuable in being able to help them out. So. Been here for about a month, but I'm going to be planning on being here for quite some time now.
So I think the biggest thing that I've learned while coming here over the on and off through the first year of my medical school career is that it's been really awesome taking things that I've learned in the classroom and applying them to the clinical perspective of medicine, and not only kind of seeing what we're learning in action, but also learning from our patients and being able to expand our knowledge.
I've been coming to the Midvale Clinic for about a year and a half. What I've learned the most about coming to this clinic is working in an interprofessional team. I've learned so much from other students from different professions. They really helped me expand my knowledge, and of course the patients are great, and it's a population that I'm interested in, so that's what I keep coming.
I've been coming here for a little bit less than a year now, and I just come because this is the population of people that I grew up with, and so some of these people are my neighbors, and so I'll just it feels good to help them out.
I think it's very unique because other places have the same program, yet they don't have this experience. So this really ties in the knowledge, the teamwork together, and it really helps you give back to the community. So it's very important to me because I also grew up here in Midvale. So being able to give back to the community and basically see how much these people need help and be able to give that to them is something that's very rewarding to me.
And I think that one of the big tenets of what we do here is to learn from one another, but also to learn from our patients and allow our patients to teach us so that we may be able to provide better care. This is a very important model.
We feel that the population of patients that we take care of are very noble people, and I'm impressed with how hard they work in general, and how hard they work to take care of themselves, and how diligently they are about following our advice and taking the medications we prescribe. And that's unusual for us. It's a great experience for us to see patients who really want to be taken care of and want to get well and want to participate in their care. So it's a very positive experience for all of us.
What we receive is much greater than what we ever can give.
I've been with the CBC for 6 since they opened, and we started in the back of a motorhome, so I've seen the clinic evolve from being in the back of a motorhome to what it is now. The dentists that volunteer here are just wonderful. We used to do just fillings and extractions, but now we are getting prepared to do endodontics and crown and bridge, and also dentures and partial dentures. So it's evolved quite a bit.
I'm a Midvale resident, have been a Midvale resident for many, many years. My dental practice was at 4263 Highland Drive, where I practiced general dentistry for over 50 years. As a general practicing dentist at Highland Drive, I had a great interest in doing volunteer dentistry also. So on my day off from doing general dentistry, I began doing volunteer dentistry early in my career at different places. Became acquainted with Mauricio Agramont, who was working on developing the CBC program here in Midvale. And we decided that we could develop a dental program through the CBC program. We started seeing patients here in Midvale, and it was a pleasure to see the patients who would come in who were in dental need. I would encourage the city council to give additional support to CBC, and with my involvement with the dental clinic, to consider ways that the city council can give additional support in all ways, even financially, to CBC.
My name is Thomas Dixon. I'm a volunteer dentist at the Midvale Community Center, and have been enjoying it tremendously for several reasons, not the least of which is what it gives me back to be able to help people that have very little other avenues of help. You're actually giving people that have no other avenues, and it's very gratifying to me personally to have an absolute need even partially being filled by my efforts. I've been in Midvale for the last, I've been practicing for 23 and a half years, and I'm up over on Fort Union, so I'm fairly close by in the neighborhood, and I speak Spanish, which is very helpful for the staff and the patients, and I thoroughly enjoy it. A typical well-trained dentist could bring to the table skills that are hugely in demand here and hugely appreciated. And the other thing is, you don't need to have 12 hours. You can come here for 7, you can come here for 5. And 5 hours on a day is disproportionately helpful to the patients, more than the doctors realize. Having done this as many times as I have, I've been able to see it. But you come in here, you work for 5 hours, and you say, the need is so tremendous, what could I do? Well, maybe that's true in the long run, but in the short run, you're the one that helped that person who had no other avenue. You're the one that helped that person who had nowhere else to go. And again, it's incredibly gratifying for me to be able to contribute even a little bit for the people that need so much.
My practice was in California, in Ventura County, California, and I sold my practice in 1996, at which time I worked for other dentists for 5 years doing their difficult root canals and third molar extractions. I retired completely from practice at the end of 2000, and from then I've been doing humanitarian service all over the world and also here at home. I've been from China to Vietnam to Ethiopia to Uganda, and I've spent most of the time, many visits to El Salvador and Guatemala, and also I've worked in the Philippines and in Israel. And so we have gone about 2 countries a year, and my wife and I, and we've enjoyed the work there. But in the last 5 years, I've been working here also. And this is at the clinic here in Midvale, Utah. And I am very happy to work here because I feel like I've been able to do more work in a year's time than I did traveling. And so I encourage anyone that has a desire to serve and to do humanitarian work to give it a try here in Midvale. I feel very gratified with doing the work here, and I feel very satisfied in my heart because I enjoy doing this. The people here are wonderful. There's good support. The staff, my assistant Wendy has had years and years of experience, and she's worked for oral surgeons, and she can hand me the things I need before